Okay, so let's start. So we're going to tackle causal inference. Causal inference. Who understands causal inference? Who understands causal inference? Who understands causal inference? Hello, time is going. Who understands causal inference? Hello, can you hear me? Can you hear me? I'm asking a question. Then Agbeko, if you can hear me, answer. So the conclusion drawn from the cause of a condition. Come again. You are on the right path. Come again.
Mr. Agboko, come again.
Oh, time is going here. I'm recording. It will make the volume big. So answer fast. Yeah, Mr. Abdullah. Okay. So that means that mosquito is a risk factor for malaria causation. So can you say that mosquito? Hello, can you see this? Can you see the whiteboard? Can you see the whiteboard? You can see the whiteboard. Okay, so I'm writing something. Okay, so we can say that mosquito don't mind my spelling, mosquito or P falciparum. Okay, let's say P falciparum. So P falciparum is a risk factor. Thus, it causes the condition called malaria. Do you all agree? Do you all agree? Hello? You all agree? And you have to be responding fast because I'm recording, Okay, so mosquito, that's P falciparum, is a risk factor. So a risk factor is also called predisposition factor. Risk factor is also called predisposition factor. Predisposition factor. It is also called a predictor. So it predicts something. So the risk factor is also called a predictor. So they are synonymous, and it's the same word. Risk factor is the same as predisposition factor, and it's the same as a predictor. And the risk factor is also called the cause. Okay, so we cannot say it is the cause, because when we say causal inference means that we are inferring causation, or we want to say that something is the cause of something. Something is the cause of something. So we can say that obesity, or we can say that salt intake. We can say that salt intake causes hypertension. So over here we are inferring causation. We are saying that too much of salt will cause what? Hypertension. Hypertension is for high blood pressure. Inferring causation. So we are saying that the intake of salt causes hypertension. Salt causes hypertension. So let me erase this one. So I will come back again. So salt causes hypertension. We can also say that too much of sugar or too much of fat causes what? Diabetes. Too much of salt, too much of sugar, too much of fat, too much of stress, and lack of exercise, obesity, they all cause what? Diabetes type 2. So let's go back to our presentation now. I guess you can see my screen now. Introduction to causal inference. Okay, so I guess you can see the objectives. You can see the objectives. Okay. So by the end of this course, you should be able to describe and distinguish between association and causality in epidemiology. You should be able to list and describe features of association that support inferences of causality. Causality is the same as causation, or causing something, causing a disease. Then you are able to also list the principal concerns in inferring causation or causality. So when we say infer, it means to draw a conclusion based on evidence, like what Mr. Agbeko said. So let me throw some light on the differences between association and causality or causation. So let me go and explain that before we follow through with our lecture. So association and causation. So let's find the difference. Association. When we say that a risk factor is associated with a disease, what is the meaning? So we have association, yeah, so we have association versus association versus causation or causal inference or causality or causal inference. Causality is the same as or causal inference. So to infer means to draw a conclusion. So when we say something is associated, a risk factor or a variable is associated with a disease. And please, whenever you hear outcome in epidemiology or biostatistics, it means what? An outcome is what? A disease. The outcome is a disease or death. What is the outcome? What is the end result? Did the patient die or he didn't die? So the death is also called mortality. And the disease is called morbidity. Morbidity. So the outcome can be the disease. Did they contract the disease? Did they get HIV? Did they get coronavirus? Okay. Or did they die? How many of the children died when they had the malaria last year at the regional hospital? So that is the outcome. So the outcome can be somebody who had the disease or died, or it can be that some had the disease, some did not have the disease. So that's the outcome. But the risk factors are the predictors, or what cause the factors that were associated with the disease. When we say a risk factor, or when we say causation, it means that the risk factor was able to cause the disease. But if we say association, then it means that the risk factor was just associated with the disease. We don't know whether the risk factor was able to cause the disease or not. And we don't know whether the disease had influence on the risk factor, or the risk factor came first before the disease came second. So for instance, we did study design last 2 weeks. For instance, in the cross-sectional study, the findings are very weak. Findings of cross-sectional study are very weak. So for cross-sectional study, they just test for association. But for longitudinal study and randomized controlled trials, they infer causation. Association means that you want to be diplomatic. You don't want to say that this person, or you are with a lady and you don't want to tell the lady that you don't have money. So you will be beating about the bush and be giving explanations upon explanation. But if you go forward to tell her, me, I don't have money, so I can't marry you, that is causation. You are speaking the truth, or you are causing something. But association means that you are just associated with it. We don't know whether the risk factor is causing the disease or not. We don't know whether the disease is having influence on the risk factor, the disease is causing the risk factor, the risk factor is causing the disease. We don't even know the direction of causation. For instance, let me give this example. The reason why you tell hypertensive people not to take salt is that you think when they take salt is a risk factor, so it's going to raise their blood pressure up to very high level. Okay, let's look at exercise. We said that those who exercise a lot are not predisposed to hypertension and diabetes. So exercise is a cause, or is causally related or associated. Is causally associated or related with what? Hypertension or diabetes. Yes. Yeah, let me admit them. So we can continue. I guess we can continue now. We can continue, eh? Okay. So we can say that lack of exercise or sedentary life predisposes people to hypertension and also to diabetes. Lack of exercise predisposes people to hypertension and also diabetes. Okay, let us also find out that smoking, when you smoke weed or cocaine, let's say weed or marijuana, Indian hemp, cigarettes, do they cause lung cancer? Do they cause hypertension? Yes, they do, because a lot of studies have come out to explain that this smoking and weed and those things, they all cause lung cancer. Let me explain this one also. So all the explanations I've given are on causation or causal inference or causal relationship, because they lead to morbidity or mortality. Morbidity is the same as disease, mortality is the same as death, and they are the outcome of a research or outcome of a scientific research. Okay, so when we say association, let me explain association. For instance, you come to regional hospital and you realize that all the pregnant women who come to the hospital to deliver, you realize that those who come with their husbands to the maternity ward to come and deliver, when they give birth, their babies resemble their fathers. Whether it's a girl or a boy, the face is like the father. But those women who come and their husbands that do not come with them, and when you even call the husband, he said, me, I don't even know that my wife is pregnant. Me, I don't have money, I will not come. Those women, when they deliver, their children, you don't even know whether they resemble human being or monkey, because the father is not supporting the mother. So the baby will come out, you don't even know whether it resembles the grandfather or whoever. Please, this is just an example I am giving. It is not true. So this is the finding that is an example I am giving. So can we say that for your baby to resemble the father, then it has to be associated with the father escorting the mother to the maternity ward and caring for the wife. And when you do that, the baby will resemble the father. This is my hypothesis. And a lot of researchers will come to disprove this hypothesis. So later they will come out and say that another person will do a study and say, That is not it. The babies who resemble their father is just because genetics, they are supposed to resemble their father. Those who don't resemble their fathers, maybe they resemble their father's father or their mother's father. So that is also genetic. So whether you escort your wife to the maternity ward or you don't escort her to the maternity ward does not have any relationship with your baby resembling you or not. So, yes. Okay, let me admit. Okay, so when you say association, this example I gave concerning fathers who escort their wife to the hospital, you realize that another person will come out and say no, it doesn't have any relationship. So with this one, I'm just testing for association. But I'm not saying that chinchra by force. If you're a father and you escort your wife to the maternity ward, when she gives birth, the baby will resemble you. No, I cannot say that. So this one is just testing for association. I say, oh, you giving for your baby to resemble you, it is associated with you going or escorting your wife to the maternity ward. That is the association. Another person will come and disprove it and say that, oh, it is not true. It is just by genetics. It doesn't have any relationship. So that's my hypothesis. Another person's hypothesis will come and disprove my own. So I tested for association. So with this kind of experiment, we just do a cross-sectional study. A cross-sectional study is also the same as a prevalence study, because you cannot make strong conclusions. You cannot say that what I'm saying, that is what is supposed to be done in the whole world. The whole world has to accept the fact that if you're a husband and you escort your wife to the hospital, the outcome, which is the baby, whether it's dead or alive, will resemble you, the father. This is not a strong conclusion. It is subject to scientific investigation and empirical data to disprove it that it is not true. You understand? So it's just associated with it, but it is not the real or actual cause of the outcome. But if you say causation means that when you take in, we all know that if you don't exercise, you will get hypertension or diabetes, and it is in the forward direction. The causation here is in the forward direction, because you not exercising, you taking a lot of salt, you taking a lot of fatty meals, and you eating late in the night. I've just mentioned about 5 risk factors for you to get metabolic syndrome or hypertension and diabetes. You not exercising well, you not eating early, you're eating late in the night, you taking fatty meals, you taking in a lot of salt, will lead to getting hypertension or diabetes, which are classified under metabolic syndrome. You understand? So the diabetes, the salt intake, the fat, eating late, not exercising, they all come before the outcome. So they are called exposures. They are also called exposures. So predictors are also called exposures. So these are what you were exposed to. That is what led to you getting diabetes and hypertension at a younger age. Instead of you to go to the gym, you didn't go. You eat late. When you finish eating, you will not even walk around. Then you go and sleep, and your stomach will become as big as my own. It's not good. Myself, I've regretted that my stomach is big. My wife was cooking a lot of fufu for me, and I thought she was doing me good, not knowing my stomach would be big. So that is just by the way. I'm working on it. So let's go to the lecture. I guess you all understand the analysis I've made. Yeah, okay, then let's start the lecture. Okay, so what is a cause? In epidemiology, a cause can be considered to be something that alters the frequency of disease, health status, or associated factors in a population. So causal inference, according to the epidemiologists, it means to draw a conclusion based on evidence. And the evidence is the scientific data that you have, the data you collected for your analysis, the data you collected, the samples you ran. That is the evidence. Okay, so we are still on cause. In the general sense, when we say a cause, it's something that if it weren't there, some cases of the disease wouldn't have happened. For instance, the cause or predictor or risk factor or exposure, if it weren't there, then you wouldn't have contracted the disease. For instance, you not eating early and you eating late in the night, you taking a lot of fatty meals like fried rice, you taking in a lot of salt, being quick-tempered, all these are predisposition factors for metabolic syndrome or diabetes and hypertension. So if you remove the cause or the exposure, if you don't take in meat, if you don't take in fatty meals, if you exercise a lot, if you don't take in salt or you take moderate amount of salt, don't take in a lot of sugar, you are not predisposed to metabolic syndrome or hypertension and diabetes. So that is the meaning of cause. So the cause or the risk factor has to come first before the outcome, which is the disease or death. So this definition allows that factors can play a direct role or an indirect role. So the risk factors can play a direct or indirect role in causing the morbidity or disease or outcome. For instance, a factor may not be capable of causing disease all by itself. It may be just one part of a more complex mechanism that necessarily involves other exposures or factors. So what it means over here is that for somebody to contract hypertension or diabetes, it is not only one risk factor that can cause the disease. A whole lot of factors. I mentioned about 4 of them. I said not exercising, living a sedentary life, intake of alcohol, smoking, excessive intake of salt and sugar. These are all risk factors. So we cannot say that only salt will cause hypertension. It's not only salt. So that's why if you are controlling hypertension and diabetes, you have to be sure to exclude a lot of factors. Reduce your intake of salt, do a lot of exercise, reduce intake of sugar, do not live a sedentary lifestyle, do not smoke, do not take in alcohol. So all these risk factors, when you regulate them, when you stop them, they can be able to help you to live long, not to contract metabolic syndrome, which is diabetes or hypertension. So for instance, not all smokers get lung cancer, because we know that smoking, from empirical data, has been shown that smoking is the causative risk factor for lung cancer. So smoking is not sufficient all by itself to cause lung cancer in all smokers. There may be other factors like the intake of alcohol, and a whole lot of factors that can cause lung cancer, but not smoking alone. Okay, so let's look at okay, so association versus causality. So we say that in a variety of situations or settings, public health professionals are called on to distinguish between association and causality. And this distinction, that is, and subsequent actions taken as a result, may have far-reaching implications for the public health or for the public's health. Let's set an example here. When outbreaks of infectious diseases occur, there usually is an urgent need to identify the source or the risk factor or the exposure or the cause of the problem as a basis for developing and implementing control measures. And some of the control measures can be that for COVID-19, washing of hands regularly, disassociating yourself from people, so all this, and even the vaccine, COVID-19 vaccine. If you know the cause of the outbreak or the infectious disease outbreak, you can be able to rope in some control measures. Washing of hands regularly, not hugging people, not crowding together, because we know that the cause is what? A DNA virus. So with this DNA virus, we have to exclude ourselves, wash our hands regularly to control it. So in this situation, it's important to distinguish between factors or agents that are merely correlated with disease and those that are truly causal. This one means that there are some factors that are really merely correlated, or whenever you see correlate is the same as associated. So whenever you see there are some risk factors that are just associated with diseases, and there are other risk factors that are truly the cause of the disease. So we have to be very, very sure about it. For instance, we can say that for those people with HIV, we can say that fungal infections are associated with HIV, but they are not the actual cause of the HIV. HIV is caused by what? The human immunodeficiency virus. But when the person is immunocompromised, then fungal infections can come in. Candidiasis can be Candida albicans can be in the bloodstream of the person because the person is immunocompromised. Common intestinal flagellate will be a problem for the patient. Common organisms that under normal circumstances in a healthy person will not cause any infection will now be causing infection in people with HIV. Their fat metabolism becomes dysregulated because they tend to even have something we call angiosarcoma, a heap of fat at their back. These are all associated, but the actual cause of the of the HIV itself is the lentivirus called what? Human immunodeficiency virus. That is what is causing, destroying the immune system of the person for other opportunistic infections or organisms to be associated with the disease. So the removal of the cause or the causative agent, if we have antiviral drugs that can target the HIV virus, which is using the human genome, destroying the human genome, destroying the human white blood cells defensive mechanism in order to make the person immunocompromised for opportunistic infections to set in. if we target the HIV virus, then, so if we target the cause or the causal agent, then we can be able to control the outbreak of whichever infectious disease we are handling. So, causal inference was the first step in a variety of notable epidemiologic accomplishments, such as decreasing coronary heart disease, mainly by decreasing smoking. So, coronary heart disease is associated with what? Or it leads to myocardial infarction. Coronary heart disease leads to what? MI. It leads to myocardial infarction. You know, when we talk about coronary heart disease, it is caused by hypertension, uncontrolled blood pressure. So if your blood pressure is not controlled, it brings a whole lot of complications. And when we say an infarct is formed, it means what? When there is limited oxygen supply to an organ or a tissue, it leads to the formation of infarct. So this is an infarct. So coronary arteries are arteries which supply blood to the heart. So they supply blood to the heart. The heart is also called myocardium. The heart is also called precordium. But let's use the myocardium. So whenever there is a limited supply of oxygen to an organ or a tissue, it leads to the formation of infarct. Infarct means dead cells. Necrosis will set in and the cells will be dead. So that's why it's very dangerous. If you have myocardial infarction, it leads to what? Chest pains. And when somebody complains of chest pains, which is as a result of myocardial infarction, it means that there is limited supply of oxygen, because this one arises in the coronary arteries when there is a thrombus formation in the coronary artery, and this process is called atherosclerosis. Sclerosis. So when there is atherosclerosis, thrombus is formed in the coronary blood vessel which supplies the myocardium or the precordium. So when this happens, blood is not able to get to the heart to supply the nutrients and the oxygen that the heart muscles need for the heart to survive, because the heart is also an organ. So this leads to what? Infarction of the heart, and that is the condition we call it myocardial infarction, and it's as a result of uncontrolled hypertension, diabetes, and the rest, leads to the heart itself being compromised. So over here we can see that the risk factors that are associated with the cause of myocardial infarction are smoking. But when you smoke, we have some receptors called nicotinic receptors and muscarinic receptors, which have their neurotransmitter to be acetylcholine. So acetylcholine binding to the nicotinic or muscarinic receptors leads to high blood pressure. The second one is for cholesterol levels in the population. If the cholesterol is so high, it will lead to what? Atherosclerosis or thrombus formation. And this thrombus will block the coronary arteries that supply the heart with blood. Because the heart itself, as it's supplying the whole body, itself has to be supplied by blood. So that it can also, as it's supplying the whole body, it also needs to survive. It also needs to feed. It also needs to regulate its own metabolism and respiration. Therefore, if the coronary arteries are blocked by a plaque, or a thrombus, or an atherosclerosis plaque, then blood cannot be able to be shunted or perfused to the heart itself, to the coronary artery. So the myocardium or the heart will become infarcted. So these two, smoking and cholesterol, predisposed to high blood pressure. So we can say that causal inference was the first step in a variety of notable epidemiologic accomplishments, such as decreasing coronary heart disease, mainly by decreasing smoking, cholesterol levels, and high blood pressure. So we say that smoking and cholesterol and high blood pressure leads to what? Or smoking and cholesterol lead to high blood pressure. So when we are able, if we want to decrease coronary heart disease, then we have to decrease smoking, cholesterol intake, then high blood pressure. So if you are able to control your blood pressure by taking your medications well, then your heart is going to be fine, like a baby's heart, to be able to pump blood, like a newborn child or a young child's heart, to be able to pump blood well for you. So, association in epidemiology. So epidemiologists often talk about association between variables. What we mean by association in a general sense is that there is a relationship or a connection between a certain exposure and a certain disease or health event. So like I said, there is a relationship. But we are not saying that by force, that risk factor or the variable or the exposure is what is causing the disease or the condition. We are just saying that there is a relationship. Whether the exposure or risk factor comes first before the disease comes, or the disease comes before the risk factor comes, we don't know. We don't know the direction of causation. We don't know which one comes first and which one causes the other. So we say that we don't want to commit ourselves. So we say that there is just a relationship or association. But if you say there is a causal relationship or there is causation, it means that salt intake, not exercising, what do we call it? Smoking, eating late at night, and all these things, they cause the disease. So you have defined what really causes a disease. But if you are not sure, you say that it is just associated with the disease. So in other words, an association exists in a situation in which the frequency of the disease differs based on the presence or absence of the exposure of interest. So, in other words, an association exists. An association exists in a situation in which the frequency of the disease differs based on the presence or absence of the exposure of interest. So, when the exposure is there, what is the frequency of the disease? When the risk factor is there, what is the frequency of the disease? How many people contract the disease based on the risk factor, or based on the predictors, or based on the causative factors? How many people contract the disease? So the names for exposure commonly used are factor, risk factor, characteristics, or attribute. So whenever you see exposure, it means factor, risk factor, characteristics, or attribute. They are the same thing. So that is what causes the disease. So we can say, if you are not sure, you say that, and you have a cross-sectional study which is a very weak study, we cannot be able to make strong conclusion, then you say that, oh, the risk factors are associated with the disease. For instance, if you are looking for people with anemia, and you classify anemia, or people with diabetes, and you classify diabetes as what? Fasting blood sugar, which is above 7. So the diabetics have fasting blood sugar above 7, and those who do not have fasting blood sugar, do not have diabetes, have fasting blood sugar less than 7. So you can say that of these two, when you measure their cholesterol level, the cholesterol level was higher in the diabetics, but lower in the non-diabetic. So with this is just, you have just measured the level of a biomarker, which is cholesterol, serum cholesterol. So you cannot conclude that high cholesterol is causing diabetes. No. You have to run some tests. So the tests you are going to run, these are some of the tests that will infer causation. These are some of the tests. Let me clean my whiteboard. Patience, let me clean my whiteboard. So the test that will infer causation, or help us to say that, oh, if you have high cholesterol, it will definitely lead to you having diabetes. Because we checked for cholesterol level in diabetic and non-diabetic women, and we saw that diabetic and non-diabetic people, and we saw that the diabetics have high level of cholesterol. But you cannot say that if you have high level of cholesterol, it causes diabetes, unless you run some tests, statistical tests. And the statistical tests that infer causation, they are: 1, we have something we call ROC curve. ROC curve. And ROC curve measures 1A. It measures sensitivity. So you say that, oh, this diagnostic test is very sensitive, or this test kit is very sensitive. So we are measuring sensitivity. B, we measure specificity. ROC means that ROC test means receiver operator characteristics curve. So we measure is under it, we have sensitivity, specificity, and area under the curve, AUC. Area under the curve. So these are the tests under ROC. So sensitivity will give you the percentage of the marker. The marker over here is the cholesterol. What is the sensitivity? If you get cholesterol sensitivity to be about 90%, it means that almost everybody that we tested with diabetes are predisposed, or is positive. Cholesterol really implies that if you have high cholesterol, it means that you have diabetes. That is the sensitivity. Specificity will mean that if you have cholesterol, high cholesterol level, there is no way you don't have diabetes. You will have. So we have sensitivity, specificity, and the area under the curve also predicts that, oh, all those who are under the area having higher cholesterol level, they are going to have what? Diabetes. So if this is the area under the curve, so all the people having diabetes will be over here. So all the people over here are what we call hello class, network went. Okay, so all the people over here are what? Those who fall under AUC. So all the people over here are those who fall under area under the curve. So all the people so I lost connection small, sorry. So all the people over here in this shaded region of the curve are those who fall under the AUC. So we mean that if they are over here, area under the curve is about 0. It runs from 0 to 1. Area under the curve runs from 0 to 1. So if you have about 0.7, it means that it's a very good diagnostic tool. Okay, so I've finished with ROC. So let me clean it so that we start other measurements. And this one's the one who is teaching you the biostats, Dr. Benjamin Apam, will take you through how to carry out this test. I would have loved to take you through all these tests, but time, we have shared the work, so for now he's the one doing the statistician doing that. So let's see another test. So I finished the ROC. So number 2, another test we have is linear hello. Oh, sorry, we went off. Sorry. Hello, can you see now? Can you see? Can you see now? Okay. The network went off, so I tried again. So it's good you have told me. Okay, so are you following? Okay, so let's go to the I was saying that, but did you get the portion on the ROC? Oh, the ROC, I said under ROC we have sensitivity, specificity, and area under the curve. Did you get that? Did you get the area under the curve explanation, the curve that I drew? Okay, but so did you get the specificity explanation? Okay, so let me give you the curve. So the area under the curve, I said that when you draw a curve, and this is a horizontal, if you say here, the shaded portion, it can be 2 places. If you have, oh, you can't see the screen. Oh, the whiteboard is not showing. Oh, I'm coming. Can you see it now? Can you see the whiteboard now? Okay. Can you see this thing, the slides? Okay, then you have to check your connection. You have to check your connection. Is it everybody? Okay, so can you, I'm sharing again, can you see slide 8? Can you see slide 8? Okay, what is, read it and let me hear. Okay. Okay, so let's go to the whiteboard and let me see whether you can see that one too. Can you see the whiteboard? It's not there. Yes. It will show, it will show. But you need to get the explanation, it's very important.